Let's talk about your family health and pregnancy for just a moment. Did you know nearly 70% of pregnant moms experience some type of morning sickness during the first few weeks of their pregnancies? Well, our partners at Arizona Parenting Magazine have a great article on morning sickness in this month's edition, and you can check it out online as well. And joining us now is Dr. Lisa Jacks. She's from Banner Thunderbird in Glendale. Nice to see you.
Thank you.
And as an OBGYN, we're going to get the scoop from you on what's going on with our bodies. Why is it that some women have morning sickness and other women don't?
Well, we do believe that HCG levels probably have the biggest effect on why some people get morning sickness. So women that are having twins or more, many times will get morning sickness worse, but also a personal or family history can increase the risk. Excessive psychosocial stress. Patients that have migraines tend to have worsened morning sickness, as well as people that get motion sickness easily.
Wow, okay, so you could actually ask your mom if she had morning sickness to know if you might get yours as well.
Exactly.
I never knew that. Okay, that's interesting. Let's talk about some of the ways that you can combat it, because there are some real practices you can put into place.
Absolutely. There are a lot of more natural remedies. If you are worried about taking prescription medications for nausea, I usually recommend that my patients start with vitamin B6 supplementation. They can take up to 25 micrograms every 6 hours. Ginger ale or ginger capsules are helpful. Small, frequent meals that are bland, avoiding fatty foods. Those things do help.
Helps do it. The spicy fatty foods are the ones that really kind of get you when you don't have a whole lot of room in there.
That's correct.
All right, very good. I have to ask you this, fact or fiction? When you're having a boy, you're more likely to have morning sickness.
That's actually fiction. The studies have shown that actually morning sickness is worse with a female fetus, and we think that has to do with elevated levels of estrogen in the body from the female fetus.
Oh, okay, so it's the girls that are causing the problems early on.
Yes, that's correct.
All right. When do we know whether morning sickness is normal or when it's really extreme and we need to actually be concerned about it?
I usually tell my patients that if they ever don't keep any food or water down for 24 hours, that they need to seek attention at a hospital. If they become dizzy or feel like they're going to pass out, if they ever throw up blood, if they notice that their urine is very dark, those are signs they're becoming dehydrated and they need to seek medical attention.
Okay, so any of those signs are cause for a call to the doctor right away. You know, people talk about morning sickness, and some people say, oh, I only had it for a couple days, and others say, are you kidding? I had it almost the whole entire time. Do we know when our pregnancy starts what's going to happen there, and when can we generally expect that it would be over?
Well, usually most patients will begin experiencing morning sickness by around 6 weeks of pregnancy. The HCG levels, which are the pregnancy hormone levels, continue to go up until patients reach about 10 weeks, and so definitely morning sickness peaks at around 10 weeks and then it begins to wane, and usually is better by 12 to 14 weeks of pregnancy.
All right, so by then you're on to other things.
Usually.
Aches and pains and joints moving and things like that.
Exactly.
Okay, Dr. Jacks from Banner Thunderbird, thanks so much for being with us.
Thank you for having us.
All right.